often have to tease apart what aspect of the patient's presentation is a function of a psychiatric illness, it's a function of a medical problem, cognitive impairment, psychological reaction, is this part of the social structure, or is this maybe a cultural variable? So that's the first step, is being able to keep all these things in mind, and that diagnosis, which is the pointer really of treatment, is not a one-time affair, it's really a process. And it entails not only talking to the patient, but also getting collateral from their medical providers, their family members from the community who know them well. And after that, we can sort of establish a sensitive and individualized treatment plan that often entails different modalities, including individual therapy, group therapy, substance abuse counseling, doing a lot of reach out to the community, case management, and a very strong psychoeducational component. I think that's key. I personally feel that groups are very, very powerful to help patients remediate many of these experiences. First of all, it gives them an opportunity to be part of a group, to feel included in a group, to be part of perhaps men and women who have experienced the same difficulties. We have to remember that many of these patients are incredibly isolated. So group membership is very powerful.
That's the advantage of this shift towards more team-based care and task shifting, where you come up with a collaborative care plan that's involving everyone around the table, and it's clear who's doing what, and you sort of defragment the sort of silos between disciplines, and you start to identify with a team more than with a particular discipline or a particular unit or department. You sort of, the patient's care team becomes the new unit, and that shift in identification and breaking down those silos is what's happening with a lot of these sort of changes in the healthcare delivery system, and sort of incentivizing more team-based care.
We offer comprehensive mental health services to patients that fall into one or more of the following three categories. One of them is LGBT community, people that are infected or affected with HIV. And the third one would be comorbidity of mental health disorder and a substance use disorder, or a dual diagnosis. And our patients come in an array of very complex mental health problems, and they also come in different stages of the development of their sexual and gender identity. Okay. We treat patients that from very diverse ethnic backgrounds, and they're also largely underprivileged and largely underserved.
And I think it's incredibly prevalent that many of our patients come in not only with recent trauma, but we see a lot of patients that have recent trauma instances like the ones that you describe, but also have very complex histories of childhood abuse or neglect or physical abuse, and this compounds with most recent trauma. So their patients are incredibly challenging to treat. First of all, because they come in already with a bias that they will be rejected, that they will be violated, they will be perhaps not treated, very well, and that's a barrier for treatment. So, often we see a lot of ambivalence of wanting help, at the same time being very scared of getting that help because of these experiences.
This population is so used to being marginalized and stigmatized that they learn to compartmentalize their own struggles, and sometimes they delay medical or psychiatric help. I think it's important to keep in mind that even after a patient has been diagnosed and the treatment has been established, the treatment plan, I think we need to be flexible, and we need to make sure that the evaluation and the assessment is an ongoing matter, because sometimes these complex diagnoses change over time. Like sometimes the substance abuse stops, and then something else comes to the surface that we could not see because of the other problems. So sometimes the medical comorbidities are better managed, and then we can actually treat the psychiatric illness better. So I think it's important to keep in mind that because of these complexities, we need to have an ongoing assessment of what the patient problem is, and then tailor the treatment.